We should check our ultrasound machine. First instance, turn it on and check if the probe that flashes is the one that you intend to use. As you can see in this image, there are two probes on the ultrasound machine. A small one, which has a straight curve, and a more curved one, mainly used in obese patients. Now we should check our screen and our settings on the machine as well. Check the depthness and adjust the brightness of the screen. Make sure that the ultrasound machine is set on CVC, as in case you will need to use colors to identify the vein, you will be able to do so. Apply the sterile long sleeve on the probe. In order to do so, roll the sleeve backwards on your hand. Apply some sterile jelly inside the sleeve to assure better conductivity. And roll it over your probe once handed by your assistant. Make sure you keep it sterile. No air should be trapped between your probe and the sleeve in order to assure a better image. Add some more jelly on your probe. Before proceeding with anything else, check your ultrasound probe to see which part is medial and which part is lateral, and start scanning the neck, applying the probe gently on your needle insertion point. Look for the best picture, scanning the neck up and down until you can identify appropriately the vein and the artery. The vein is identified by applying gentle pressure with the probe. The non-muscular vein will collapse easily, whereas the artery will remain relatively circular. This image is called out of plane. But once identified your vein, if you roll your probe in order to become parallel to the vein, you will have in-plane image, considered to be standard of care. Insert your needle at 45 degrees to the skin by applying gentle suction to the syringe under direct vision. Once into the vein, blood will flow easily into your syringe. Now disconnect your syringe and check if your blood is dark color and is not pulsatil, as a confirmation you have not inadvertently punctured the artery. Hold the needle with your non-dominant hand and insert the guide wire. Ask your assistant to check the monitor for any signs of arrhythmias, which means your wire is too far in. If that's so, withdraw a little bit. Withdraw the needle by holding your guide wire and check the placement of your wire with the ultrasound probe again, using both ways, in plane and an out of plane method, where your guide wire will appear as a shadow in the middle of the vein.